Colon cancer is a major health concern, being the fourth leading cause of cancer-related deaths in the United States. Over 100,000 new cases are reported each year, affecting approximately 1 in 25 adults. What's even more alarming is that most cases don't show symptoms until the disease has spread significantly. But here's the key: knowing the early warning signs can make a huge difference. In this video, I'm going to share the top 10 early warning signs of colon cancer that you need to know about. Make sure to watch until the end, because there's one sign that might truly surprise you. If you find this information helpful, please hit the subscribe button to stay updated on important health topics. Now let's get started. Number 1. Blood in your stool. One of the earliest and most common signs of colon cancer is blood in your stool. If you see bright red blood, it often indicates bleeding in the lower intestinal tract or rectum. On the other hand, maroon or darker colored bowel movements can be a sign of bleeding higher up in the gastrointestinal tract. Have you noticed any unusual colors in your stool lately? While blood in your stool can sometimes be caused by less serious conditions like hemorrhoids or anal fissures, it's crucial to consult a doctor to rule out any serious causes. This symptom should never be ignored. Number 2. Changes in bowel habits. Persistent changes in your bowel habits are another significant early warning sign of colon cancer. This can include constipation, diarrhea, changes in frequency, incomplete bowel movements, and even a decrease in stool thickness. Have you experienced any of these changes that just don't seem to go away? While these changes can be due to dietary adjustments, disagreeable foods, or infections, if they last more than a few days, it's important to see a doctor to find out what's really going on. Remember, your body is trying to tell you something. Number 3. Anemia. Anemia, characterized by a lack of healthy red blood cells or hemoglobin, is another common symptom of colon cancer. These cells carry oxygen to your body's tissues, and without enough of them, you might feel unusually tired, short of breath, or lightheaded. Have you been feeling more fatigued than usual? Even if you haven't noticed any visible bleeding, internal bleeding could still be happening. If you're feeling unusually fatigued, it's crucial to consult a doctor, especially if you're experiencing other symptoms from this list. Number 4. Loss of appetite. Loss of appetite can be an alarming sign, especially if it's out of the ordinary for you. Cancer cells can release substances that change how your body processes food, leading to a reduced desire to eat. This symptom is often linked to both metabolic changes and reduced dietary intake. Are you finding that you just don't feel like eating anymore? Pay attention to this change. This could quickly lead to malnutrition, which has serious impacts on your overall health. Number 5. Unexplained weight loss. Unintentional weight loss is a hallmark sign of many types of cancer, including colon cancer. If you're losing weight without trying, this could be due to persistent diarrhea or difficulty digesting and absorbing nutrients. Coupled with a loss of appetite, it's easy to see why weight loss can happen. Have you noticed the numbers on the scale dropping for no apparent reason? If so, it's time to see a doctor. Unexplained weight loss is always a reason to be concerned and get checked out. Number 6. Nausea and vomiting. Persistent nausea and vomiting can also be a sign of colon cancer. Cancer cells can release substances that alter how our body processes food, and a tumor in the rectum can obstruct the intestines, causing a buildup of waste and toxins. This leads to nausea and vomiting as your body tries to rid itself of these harmful substances. Are you experiencing these symptoms along with others? It's important to consult a doctor to rule out colon cancer. Persistent nausea and vomiting should never be ignored. Number 7. Diarrhea. Diarrhea, especially if it's persistent, is another early warning sign. Defined as loose, watery stools occurring more than 3 times a day, it's a common symptom of many conditions, but can also indicate colon cancer. Have you had diarrhea for more than a few days? Or is it accompanied by other symptoms on this list? Don't ignore it. See a doctor. Persistent diarrhea could be a sign of something more serious than just a stomach bug. Number 8. Abdominal pain. Abdominal pain can be a symptom of many different conditions, but it's also a warning sign of colon cancer. Cancerous tumors in the colon can obstruct the intestines, causing a buildup of gas and waste, leading to pain, distension, cramps, and bloating. Is your abdominal pain severe enough to send you to the emergency room? it's important to get it checked out. Don't dismiss persistent abdominal pain, especially if it's unusual for you. Number 9. Chronic fatigue. Feeling unusually tired. Chronic fatigue is a common symptom of many types of cancer, including colon cancer. Research shows that fatigue occurs in about 80% of patients with colorectal cancer, with 30% experiencing chronic fatigue, especially those undergoing chemotherapy. Malnutrition and weight loss from colon cancer can also contribute to this tiredness. If you're experiencing fatigue that's out of the ordinary, it's important to see a doctor. Chronic fatigue that doesn't go away should be taken seriously. Number 10. Pelvic pain. Lastly, while not an early warning sign, pelvic pain can indicate that cancer has spread from the intestines to the pelvic region. This is a serious complication that requires immediate medical attention. Have you had intestinal issues in the past and now experiencing pelvic pain? It's crucial to consult a doctor right away. Pelvic pain can be a sign of advanced disease and needs prompt evaluation. Understanding these signs and symptoms is crucial because early diagnosis can lead to more successful treatment options. Let's recap the early warning signs you need to be aware of. Blood in your stool, changes in bowel habits, anemia, loss of appetite, unexplained weight loss, nausea and vomiting, diarrhea, abdominal pain, chronic fatigue, and pelvic pain. If you experience any of these symptoms, please make an appointment with your doctor as soon as possible, because the sooner you catch it, the better your chances of beating it. If you found this information valuable, please subscribe to our channel and hit the like button. Your support helps us create more informative content. Remember, we are not doctors. This video is for informational purposes only. Thank you so much for watching and take care of your health.